several groups at the time documented the damaging impact of the OG global gag rule, 1.0, 2.0, which really focused on healthcare funding and health systems. Um, and it prevented groups that accepted U.S. foreign assistance from advocating on abortion and providing referrals and all that. That's why it was called a gag rule, so that if you took U.S. money, you couldn't even speak about abortion, even in a country where abortion had been legalized or decriminalized. So, but groups really documented, and IPAS did that as well as others, the damage that this policy caused to health systems more broadly.
There
Right.
was such a big push around that in the 2000s and the 2010s. And the whole idea there was I, as a pregnant mother, could go to a point with my child and get a slew of services,
Mm-hmm.
including, gender-based violence programming, nutrition for my child, the jabs and vaccines that we both needed. It makes sense, especially as you were talking about the example from Kenya, remote areas where it's hard to get to a health system. It's hard to, the amount of walking and all the rest, you want one point of contact. And that was the best way of reaching the hardest to reach people. If you go after the one organization that is providing those services because they want to also be able to refer young women, young people for all other services, including safe abortion care, the amount of people you're losing as a result of that closure of that clinic, or the inability of some service providers use vehicles to reach people and to do mobile clinics.
Right.
You are cutting off whole communities, not just that individual person with child. And I think that that's what we don't talk about enough, the damage of these types of ideological policies. And that's the thing is, they're not about human flourishing, as you mentioned at the beginning.
If you're asking them to do all this to access healthcare because of some US foreign policy idea cooked up in Washington, D.C., what are we talking about? This is totally counterproductive. It's destructive. So it started to damage the provision of healthcare, of maternal healthcare more broadly.